alaikum.
Walaikum assalam, Shabina. I'm wondering, can you see me yet or not?
So we're trying to get Dr. Samia Latif's video up on to the Salaam radio video. Unfortunately, I can't see you as yet. There may be some connection problems, but we can try again during the break. And at any time, if I can see you, I will announce that we can see you, but we can hear you perfectly fine. Are you able to hear us okay?
Yes. Thank you very much. And thank you for the very elaborate introduction.
I was going to say that you are a lady, mashallah, of many credentials. And what a privilege it is to have you on our show today.
It's an honor, Shabina, to be on your show.
Thank you. And I have been waiting for you for a very long time, let me tell you this.
I'm so sorry. I know you have.
No worries at all. It's just because it's been such a wonderful topic to discuss, and I think a very pertinent one as well, isn't it? And you've got many credentials associated with your profile. And I also noticed that, you know, you've been air quality lead of the Northamptonshire area. And I'd like to throw in a little bit of humour over here, because whenever I take the kids to school who actually cross county, I automatically feel that the air is a lot cleaner when I drive into Northamptonshire. So it must be your good doing that is contributing to all of that.
I'm not entirely sure about that, but I shall pass your comments on to our environmental health air quality specialists as well.
Oh, that's wonderful. Now, Samia, we're talking all about the flu. The flu is something that, yes, there are lots of myths behind it as well. And before we actually go on to that, I'd like to ask you, what interested you in becoming a public health consultant?
I didn't expect that. Well, I've always been interested in public health, even ever since I was a med student.
Yeah.
By knowing of the impact that simple public health measures can make on the health of the population, because as you're aware, Shabina, public health has a population approach rather than a patient focus. And simple things like sanitization, immunization, healthy lifestyle choices can make such a huge difference and have such a huge impact on the health and well-being of the population. So I think for me it was a marriage made in heaven when I found my calling.
Oh, that's wonderful. And obviously, without any shadow of a doubt, we see that, you know, your expertise. I can remember training within GP. I was just a little trainee, I was saying, and I can remember when the swine flu broke out, the circulation that takes place, obviously, of what precautions we need to take in the way of medications that's released by NHS England and Public Health England. And it had your name at the bottom of the letter. So I remember that very, very many years ago, and I still remember it to this day. Can you imagine? And I wanted to save this to tell you, because it was so impressive at that time. And I thought, oh, you know, I've got to keep this little gem of information to share to our listeners and to share to you, that at that time as well, I used to think, oh, this is amazing. It must be such a job of responsibility. And I wonder if I'll ever get to meet Dr. Samia Latif one day. And here we are. Mashallah.
I'm really chuffed, Shabina. I was myself a public health registrar at the time. So like yourself, I was in training, but I'm really chuffed that you remember me from.
Yes, so moving on from that, now let's talk a little bit about the flu. So we all know that flu is caused by viral illness. Nowadays, many of the public members know that flu is as a result of a virus, but often we get to see that people are caught sort of unawares. So for the purpose of information for the public, Dr. Samia, when are members of the public most at risk of flu or from the flu?
Right. Well, I think, Shabina, it would help if I just gave you a brief introduction into flu, and then we can sort of talk about the risks. So flu, as you're aware, it's highly infectious. It's a viral infection. It's an acute infection, and it's when the virus attacks your respiratory tract. And how it's spread, and herein lies the risk, is that it is spread from one person to another when you inhale the infected droplets. So when a person with flu, or even someone with common cold and cough, when they cough and sneeze, they then spread that virus out by either hand to mouth or even hand-to-eye contamination. And so some of it you can inhale, and some of it is when you touch a contaminated surface where those droplets have landed.
Sure.
So
Okay.
so the risk to the general public are, if you yourself are suffering from flu or the common cold or a cough, please use a tissue, cover your nostrils and mouth when you sneeze and or cough. And I'm sure you're aware of the Catch It, Bin It, Kill It campaign that the NHS ran a while ago,
Yes.
a few years ago. So use a clean tissue, sort of cough or sneeze into that tissue, and then dispose of it in a bin, and thereafter do wash your hands. So
Okay.
the risks are there, the risk of transmitting it. However, for those people who have chronic illnesses, so they may be heart patients, they may be diabetics, they may have liver disease or kidney disease, they may have a condition by which their immunity is low, so they may be immune suppressed, as we call them.
Okay.
And those who are elderly. So these are our at-risk groups, really, and pregnant women.
Okay. So pregnant women and obviously whose immunity is low, including asthmatics as well, isn't that right?
Yes, but it depends on the level of asthma as well and the degree of asthma. It's a bit of a clinical thing, but if you've got severe asthma, yes.
Okay. Well, that's I think made things quite clear, and it's important for our listeners to know about who the at-risk groups are. And if you've just joined into this studio, it'd be wonderful if you could text and call us on WhatsApp on 07745278978, or indeed you can ring us on the Peterborough studio telephone number. Put in the Peterborough code, Luton listeners, on 01733602133. And if you just want to follow the Facebook video and you could write something underneath the Facebook video, it would be absolutely wonderful. And in terms of Dr. Samia Latif, does everybody need a flu jab?
No, Shabina, there are only certain people who are eligible for the flu jab. So amongst that group, we'll start with children, really. So if you are aged 2 years up to the age of 8 years,
okay,
so it is that group of children.
Sure.
If you are pregnant,
okay,
if you fall into any of the at-risk groups that I mentioned, that is, you have a chronic heart disease, a kidney disease, liver disease, or respiratory disease, or you're immune suppressed or diabetic. And then if you look at the elderly, anyone 65 or more, 65 years old or more,
yeah,
these are the people who are eligible for the flu vaccine.
Okay, I understand. Right. So these are the groups that are eligible for the flu vaccine. And what, in the case of an epidemic, Dr. Samia, what would we do in that regard? Would then public health or NHS England then devise a plan to make sure that everybody was vaccinated, like with the case of the epidemic of swine flu, or do things have to get more worse until that would happen?
I think a little bit of understanding of how the vaccine is developed. So for every flu season, which is normally your winter months, a vaccine is produced or made by WHO,
right,
and it is made by the bugs that were found or the viruses that were found circulating in the previous flu season,
okay,
or in the southern hemisphere, because as you're aware, Australia and New Zealand will have their flu season when we're in the peak of our summer, because they're in the summer. Yeah. So based on that, the flu vaccine is made, and once it's made, it's then sort of procured for that coming flu season. So in the case of an epidemic or a pandemic, I think what the focus would be on would be, yes, vaccination is the single most important preventative thing you can do.
Yes.
But then again, only for those groups that are eligible for that vaccine that has already been produced. But what we would add on to a pandemic and epidemic, and we do it to a certain degree in normal circumstances, is use an antiviral medicine. It's an antiviral medicine, and we can treat with it, and we can also give it as a preventative drug as well.
Okay.
So, but it would we do that in normal days as well, but not to the extent that we would if we were in an epidemic or a pandemic.
I understand. Now, one of the things that has cropped up a lot of the times, and actually one of my listeners who is hopefully watching this show, has put a question forward, doesn't want their name to be sort of revealed, but has asked that is it true that there are many side effects associated with these antiviral medications if they're given to prevent the flu or given to treat the flu, in fact?
Now, there are, as with all medicines, there are certain side effects, and that's true of all medicines, Shabina.
That's correct.
And I'm sure you know that.
Yeah.
So yes, they might make you feel sick and a bit nauseous, and I don't think there are many medicines which are really very pleasant. However, what it does do, and what is proven to do, is it reduces the duration of your illness considerably. So the costs of that are huge, because then you are unwell for a shorter period of time. You don't have to take that much time off work, etc., and thereon. And it is effective. It is effective also in preventing those people who have not yet developed that infection from getting it, especially if they live in close proximity with you. That is their household contacts or residents of a nursing home, for instance.
Yes.
So the evidence is there. However, yes, there are certain side effects, but in the grand scheme of things, it does help reduce the duration and also reduce the severity of your symptoms, because as you're aware, flu can be fatal in certain people.
Absolutely. There are some really sad cases of young children that have sadly passed away as a result of contracting flu and deteriorated very quickly. And that's the reason why I find that programs like this are so important. They really are, to understand, number one, the importance and significance of becoming vaccinated, especially those that are eligible for the vaccination. And number two, to make people aware and educate them of the risks of flu and how to manage their symptoms when they have flu, and obviously the treatments that can be available. There was some recent guidance that actually came out, Dr. Samia, regarding treatment of flu, and this is just a personal thought, and for my listeners as well, for those of you listening in Luton and in Peterborough, I'd just like to reiterate that everything that Dr. Samia and myself are saying on the show, I usually announce a disclaimer to say that these views are representative of ourselves only, obviously within our own professional capacity, but do not represent the views of the organizations that we work for. And everything that we speak about obviously is backed up with credible evidence and research. So I needed to put that out there because that's what I often do announce in my shows too. And coming back to my original question, Dr. Samia, one of the things that I wanted to ask was that it's very important at this stage that a lot of people who suffer from the flu and then subsequently are recovering from it, I'm tending to see within my GP practice, are suffering from lingering coughs, bringing up of sputum that is offensive, etc., and feel that they need antibiotics. What would you have to say to that population?
Okay. Now, I'm glad you've touched on this, because this is a very, very common sort of train of thought that is found. Now, antibiotics are very, very useful to treat bacterial infections, definitely. So for someone who you think has got pneumonia or who has got sepsis or meningitis, most surely they need antibiotics. As public health physicians, we can only advise, but we do rely on our GP, such as yourself, to make that clinical judgment between when they think it is a viral infection, or if they think there has been a superimposed, and by that I mean an added on bacterial infection. And there are certain things you can do to help with the diagnosis. So you can do some throat swabs, you can take some viral swabs as well as bacterial swabs.
Okay.
And that can help the clinician come to a sort of a result. But by and large, when we talk about common cold, or when we talk about flu and the symptoms are runny nose, headache, fever, lethargy, muscle aches, tiredness, by and large, so they are always caused by viruses, and antibiotics only treat bacteria. They are not effective against viruses.
Yes, and that's very important to put down, because obviously we are facing, that's something we're going to be speaking in the second half of the show about antibiotic resistance, which is what I would call a crisis. I mean, my practice, I won't have any reservations in stating that we've had that very or not very nice letter from Dame Sally Davies, who is the Chief Medical Officer of the United Kingdom, who has said that we are already prescribing too many antibiotics. So we are on her radar, and we endeavour to decrease the number very soon. But it's important that we talk about that, and hopefully we will be speaking about that in the second half of the show. Now, I've often come across people that have come to me, Dr. Samia, and who have said, well, actually, I have 2 children who are asthmatic. I myself am asthmatic. We are at risk of flu. Yes, we have the vaccination, but little Johnny over here, who is my other son, has no medical history. He doesn't qualify for the flu, but I still want him to have the flu vaccination. And he doesn't fall within that criteria. So can the GPs actually vaccinate them or no?
No, because the flu vaccination program, which is decided by the at government level, has identified the groups of people who are eligible for that flu vaccine. And as I said, so if you're for children, if you're age 2 up to the age of 8 years, you are eligible for it. However, if you had a chronic illness like the ones I mentioned, liver disease or kidney disease or heart disease, and you are 2 years up to the age of 18 years, you are also then eligible for the vaccine because you fall in an at-risk group, as we discussed earlier. So the idea is that by vaccinating the age groups between 2 years and 8 years, you are reducing the burden of disease in that age group, but also you are providing something that we call herd immunity, which means that there are enough immune people in the community to stop the spread of flu. And as we know, children in that age group do not have the best hand hygiene. I'm sure you've seen kids rubbing their nose. The snot from the nose is all over.
I've got a couple at home.
And then not washing their hands, etc. So it is precisely that age group. And as a GP, I'm not sure if you've come across this, Shabina, but we have had inquiries about from the Muslim population about some reluctance to take the nasal flu vaccine. And although it's called a vaccine, it's actually a nasal spray. So for the children, the age group that I've mentioned, 2 years to 8 years, they're given the nasal spray. And there is a reluctance in the Muslim community, in some quarters of the Muslim community, due to its porcine derivative. Would you like to talk about that at all?
I would be so grateful if you spoke about that, Dr. Samir, because my next question actually was from a brother Fahim, who says that it is said that the nasal flu has porcine gelatin in it. I am divided as to whether to give it to my child who has asthma. Now, what are your thoughts on that?
Okay, so because this brother's child has got asthma, he falls in an at-risk group. So therefore, he's eligible for the flu vaccine, and he will be invited for the flu vaccine.
Of course.
All right. Now, let me just start by saying that flu can kill. Flu can have very serious complications, such as pneumonia, such as ear infections, meningitis, even an infection of the brain. So keeping that in mind, that flu is dangerous, it can kill. Now, the nasal vaccine, there is a porcine derivative, which means the gelatin used in it is derived from pigs. But from the time it sort of enters the factory till the time it leaves in the shape of that vaccine, its DNA is not recognizable as that of a porcine derivative or belonging to the pig. It is so much, the manufacturing process alters it so much that its sort of fingerprint is different.
Right.
That's the first thing. The second thing is that you are not ingesting it. You are not eating it. It's just a spray that's squirted in your nose, and that's it. It stays on the surface of your nostrils. And it's sort of absorbed from there. So you're not ingesting it. It's the porcine derivative is no longer recognizable by the time the vaccine is completed, its production is completed. There are no other alternatives available. The gelatin is used as a stabilizer. It helps keep the vaccine stable, and there is ongoing research, but this was found to be the best stabilizer. And also, and this is my personal opinion, as a Muslim mum myself, I have had my children being given the nasal flu without any hesitation whatsoever, because my interpretation of Islam is that if there is something that is harmful or injurious to your health, you are allowed some leeway.
Absolutely.
But having covered the facts that I mentioned earlier, the porcine derivative is no longer recognizable by the time it's sort of in the finished product.
Yes.
So bearing all of these things in mind, and bearing in mind that we have a duty of care not only to our children but to other children and to other immune suppressed people in a community.
Yes.
So if you've got like an elderly grandma or grandpa at home, grandparent at home, their immunity is already low. The worst thing you would want is for your child to come home with flu and give them the flu. So anything we can do to stop the spread of flu, and vaccination is by far the easiest and the simplest way to prevent it, along with very good hand hygiene.
Yes.
I cannot reinforce
Yes, the hand hygiene. Yes, that's come across. Listen, that has come across so many times, the hand hygiene. And I can vouch for the fact that 95% of you that are listening today do not wash your hands properly enough. And we all know that I've been quite brutally honest in the past. So please wash your hands. I've seen lots of you on my way to work. Well, I'm not going to point out anyone in particular, but many people indulge in picking of their nose, etc., which isn't a pretty sight, may I add. And you also have to be aware of the fact that, yes, your hand can carry germs. You're touching various surfaces. You're opening the doors, handles of the doors of public places and public offices, which also harbour germs. So you have to wash your hands each and every time. So please do take on Dr. Samia's advice on board. And we have 1 minute left till the break, Dr. Samia. What I would like to ask is that I'm very grateful that you've brought this up about the flu jab, about the nasal flu. I would like to second those thoughts to say that it's extremely important in view of the fact that flu can be life-threatening. I remember contracting flu in 2009. I will never forget. One of us was struck down by it and the whole house was, and I literally felt as if I really wasn't going to survive this. It was such an awful feeling with such... Very nasty, very nasty. I would never want to suffer from it again. And hopefully, inshallah, Dr. Samia, what we will do is after the break, we'll talk a little bit about side effects of the flu jab, and then we can go on to speak about antibiotic resistance. And hopefully, I'd want to get your video on as well, which hasn't, unfortunately, so I do apologise about that. But yes, if you are all listening, please do join in. We have some questions as well, which we will be asking after the break. Don't go anywhere at all. This is your very own Dr. Shabina Asad Qayyum for the Body Health and Mind Show.
Stay tuned to Salaam Radio after this short ad break.
The Truly Scrumptious Group presents the East Meets West Wedding Show, a free event on Sunday the 14th of January, 11 a.m. to 3 p.m. at the Holiday Inn Peterborough West, Peterborough, PE3 6SG. Come along with your friends and family for free goodie bags, free magazines, musicians, a huge bridal wear collection and up to 60 exhibitors. It's a great way to start 2018. Pre-register at truly-scrumptious-weddings.co.uk. East Meets West Wedding Show, Sunday the 14th of January, 11 a.m. to 3 p.m, Holiday Inn, Peterborough West.
Sadly, millions of orphans living in the poorest countries lack the necessary support for a healthy childhood. These children have to endure lives of hardship, without the basic necessities that would help them to grow, to learn, to live. Let's show them that we do care. Let's brighten up their future. Call 0161 225 0225 or visit humanappeal.org.uk.
Are you looking for a fun-loving and professional nursery? Then call Bright Bambini Montessori on Peterborough 306565. Teaching EYFS curriculum and Ofsted approved. We also offer Forest School and Arabic. Limited free funded places available. Call 01733 306565 or email info@bbmc.uk. Bright Bambini Montessori.
Third world and developing countries are home to some of the most vulnerable children on the planet. Malnutrition, severe lack of medical aid and access to clean water are just some of the horrific challenges faced by orphans across Africa and Asia. Children of Adam, a Peterborough charity, need your help to bring aid to these orphans for just £25 a month. To sponsor an orphan or assist with other projects, please call 0300 321 0032 or visit www.childrenofadam.net.
Need a great place to chill out? Look no further than The Lounge for quality food and drinks at a great price. Try our varied menu: pasta, seafood, burgers, grills, salad, soup, rice and sides. Also hot and cold drinks, milkshakes and mocktails. Leave room for our exquisite desserts. The Lounge, 417 Lincoln Road, Peterborough. Call 01733 709 306 to order for delivery. The Lounge, friendly service with a great atmosphere.
Do you own a restaurant or takeaway? Cater Fair is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices, or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
Assalamu alaikum wa bismillah. قال رسول الله صلى الله عليه وسلم كن في الدنيا كأنك غريب أو عابر السبيل. That be in this world as if you were a stranger or a traveller.
This is Salaam Radio, Peterborough's Muslim community radio. Broadcasting on 106.2 FM and online.
Assalamu alaikum. This is your very own Dr. Shabina Sidqiyum. Come back from the break, on your very own Salaam Radio 106.2 FM, covering Peterborough, and Inspire FM in Luton 105.1 FM. It's a privilege to have all of you on board, as it is a privilege to have Dr. Samia Latif with me, consultant of public health of the East Midlands. Assalamu alaikum, Dr. Samia, once again.
Walaikum assalam, Shabina.
And what a wonderful show it is, because we're already having some questions coming through, which is brilliant. And before the break, we were talking about hand hygiene, and we were sort of telling and asserting how important this actually is. Should we talk a little bit more about it?
Yes, certainly, Shabina. I think what I wanted to say was, you're very right when you say that you see people on your way to work, in public places, etc., who are sort of, we're handling door handles and desks and touching stuff which may have been contaminated or sneezed upon by someone with a cold or with flu. And regarding hand hygiene, can I just say that washing your hands with soap and warm water is the best. You can use the gel sanitizers and the alcohol rubs, and you'll find them often in places like hospitals or offices, but nothing beats a good wash with soap and warm water. And I read something once which I've never forgotten, which is wash your hands for about 20 seconds, as long as it takes you to sing the happy birthday song twice. That's just what I wanted to say. It's just something that stays in your memory, so that when you're washing your hands, sort of hum the happy birthday song to yourself twice, and that's how long it should take for you to wash your hands with soap and warm water and get into the nooks and crannies and the crevices in between your fingers and under your nails, and up to your wrist.
That's absolutely wonderful advice, because often those poor people that don't get anybody wish them on their birthday can wish themselves every single day or every single time they wash their hands. So listeners, Dr. Samia Latif's advice to you is sing the happy birthday song to yourself, and that should cover the time in which you need to be able to wash your hands properly, nails cut short as well, because it's always good. You can get a lot of bacteria or germs underneath the nails as well. And I have a Mr. Ali Khan who has sent forward a very kind comment, who has said, I've had the flu jab for a few years now and it really does help, especially if you suffer from asthma. Thank you very, very much for that comment, Mr. Ali Khan. And going back to about hand hygiene in particular, is there a difference between using bar soap or hand wash soap? That's one of the questions that I have over here.
That's a tricky one now. It depends. A bar of soap is good. However, it needs to be probably rinsed after the last person who's used it and before the next person. Okay. And most of the hand washes are good. Some of them, however, may just be more sort of cosmetic and have more fragrance and yes, not really have much soap content in them. So I'll get back to you, Shabeen, as to which. I'm not sure. We've never looked at brands or anything. Yes. But soap that can be dispensed, liquid soap that can be dispensed, yes, is usually good. So hand washes usually are okay.
Okay, that's really good. And you know why I find that interesting, Dr. Samia? Because I'm a bar soap person. I don't like the feeling of the slipperiness of the hands, but now I'm going to have to change. And the fact of the matter is there are lots of people who actually think that, when you wash your hands with bar soap, that is obviously in bath form, and you can feel that squeaky clean, that probably implies that you're much more cleaner, but actually no. And you've taught me something, that cleaning that bar of soap with the last person who's used it, that's very important as well. That's something I actually never thought about.
Yeah, just rinsing it out. It's just something I've always done. I'm not even sure if there's any scientific evidence, but yes, it just makes sense to do that.
Yes, but if a public health consultant is now saying that to me, it should make sense. So if that's something that you've done, it's something that we should all follow. So thank you very much for that input. And apart from that, the other thing I'd like to ask is, a lot of people, especially patients who I usually see, and I ask them, okay, right, we've got the flu jab, it's the flu season now. Would you like to have your flu jab? Because you have to ask for consent. A lot of them say, oh, no, I don't want my flu jab because it makes me sick, or it gives me the flu. What's the theory behind that?
Okay, so the flu vaccine is made in such a way that so the children's vaccine is different and the adult vaccine is different. With the children's vaccine, they do use a weak form of a virus. So it is a live virus, but it is very weak. And it has been treated with something that we call, it's been cold adapted. So it's been treated with like ice cold temperatures, right, so that bacteria cannot grow, and you're only spraying it, so it's sort of just in it's whilst it's in your nostrils on the surface of your mucosa, it will generate an antibody response, but by no means will it be able to give you the flu. Okay. Similarly, with the adult vaccine, it's not a live virus that's used in the vaccine. It's an inactive vaccine, so there is no way it can give you the flu. However, because it's meant to generate a response and it's meant for the antibodies in your body to detect it and mount a response, you will get some slight symptoms of maybe a runny nose, maybe a headache, both in children and adults. Very rarely a slight fever, but the symptoms should go away within 1 or 2 days. Nowhere like the symptoms of proper flu. And another thing I'd like to say, Shabeen, is people often very loosely call any cold that they get, oh, I've got the flu. The flu is a serious illness. One of my consultants once said to me that, Samia, when you've got the flu and you've got $100 bill lying next to you, you will be so weak that you won't be able to get up and pick it up. That's true. How ill you are with flu.
Yes. Oh, goodness. Right. And the fact of the matter is that, yes, it is a very serious illness. We've seen people deteriorate with it. And obviously, in relation to the question that you've just answered, we have a Mr. Christian DeFeo who also said, I had the flu jab, managed to catch the flu just the same. However, it wasn't as bad as it might have been, lasting just a week. But is this increasingly common? Is it common to see sort of transient, I would call them transient illnesses, wouldn't you?
Yes, I'm very glad you've asked that question, or your listener has, because See, the current flu vaccine that we've got on the market will either protect against 3 different types of flu bugs or 4 different types of flu bugs, depending on which vaccine you get. There are other types of flu out there as well. So any vaccine will never be 100% effective, because nothing in life is 100% certain.
Absolutely,
so but it is your best chance you have to prevent yourself from getting ill from what is commonly circulating out there, and from preventing others getting ill. Because if you're ill, like you said, Shabina, when one person in your household got it, the rest of the household followed suit.
Yeah.
So the vaccine is your best bet. However, the vaccine does not cover against every single flu strain. Also, Shabina, what we're seeing a lot of is, because we're in our winter season, it's not just the flu viruses. There are other viruses, and you'll be aware of them, like the respiratory syncytial virus, etc. There are other bugs out there that are causing similar symptoms. You've even got some bacteria that may cause similar symptoms. So it's a very fine line. But the flu, and as your listener said, you may get another type of flu, or you may get a flu which is very, very reduced in its sort of effect.
Yeah, so you get a sort of a transient upper respiratory tract type illness, which can be easily managed symptomatically as well. Now, one thing, I'm so glad that I'm doing this program with you, Dr. Sama, because a couple of weeks ago, I did a program just before Christmas on the importance of vaccinations, which is obviously going off on a tangent. And we were bombarded with questions from, well, actually, I would say this was after the show. We were bombarded with many, I would say, very unjust attacks from people who work as naturopaths, stating that vaccines killed. And conversations obviously went on. I thought, within my capacity as a medical professional, we really do need to dispel the dangerous, I would call it, rhetoric that is being spread around that people should not be vaccinated, because we have seen examples of people dying from the flu in this case, which is what this program is about. And I am part of a couple of groups, and it was very sad to see an American mother who had a child who hadn't had the flu vaccine, but healthy, bouncing bubbly boy, and their vaccination schedules are a lot different to the United Kingdom. And she said that he passed away on Christmas Day, he deteriorated. And for everybody out there who is very much for natural medication, etc., but that's fine, nobody pressurizes you into it, but do be aware that the reason why we have these programs and have experts like Dr. Samia on is to make you aware of how dangerous the flu can be. And it's something that I think should be the main take-home message today, don't you think, Dr. Samia?
Definitely, most definitely. The flu vaccine does not kill. The flu vaccine prevents you getting the flu. Protect your child, protect yourself, protect your friends and family. It is much better than getting the actual flu. The flu vaccine does not kill, but flu kills.
Okay, so thank you very much for that. Now, moving on, I have a question over here stating that I wasn't really aware and wasn't informed by my GP surgery that I could have the flu vaccine in time. I'm now in my late stages of pregnancy. Is it okay for me to have the flu vaccine?
Yes, you can give the flu vaccine at any stage of pregnancy.
Okay, that's wonderful. So, yes, sister, if you are listening and you've sent this question across, please do make an appointment with your GP in the first instance, and they can go to the fridge that's kept within the surgery. They can take out a flu jab and they can give it to you as well. So please make sure that you avail that opportunity. And in the same way, following on from that, Dr. Samia, can mothers who are breastfeeding have the flu jab?
Yes, they can. And can I, if they fall in a risk group,
okay,
because they won't be eligible for it once they've delivered the baby. However, can I also just say, I'll tell you why pregnant ladies are now included in the court. A, they're more vulnerable. B, scientific evidence has also found that if you give the flu jab to women in pregnancy, they're going to mount an immune response, which means their body's going to make antibodies to fight the flu bug.
Right.
So when their child is in their tummy or in their uterus, those antibodies pass on to the child, which is why we don't give the flu vaccine to children younger than 2 years of age, because some of those maternal antibodies are passing on to the baby.
Right.
And increasingly we're finding that with a lot of diseases, which is why we give the whooping cough vaccine to pregnant ladies as well. So there is benefit both for mum and for baby, for unborn baby, by giving the pregnant lady the flu vaccine.
Okay, and that's very useful information, I think. So for all of those that are heeding the same advice, there is evidence that is shown, as Dr. Samia has said, about... yes, sorry, did you want to say something?
Yes, I just wanted to say, because it was bugging me, I've looked up your question about the hand wash versus the soap. So
yes, do tell me, Dr. Samia. Right. Yes.
Okay, so I found it, and so the American Centers for Disease Control and Prevention recommend that people use liquid hand wash to minimize the risk of spreading harmful bacteria, particularly in public places. However, soap and water is fine, but better to use it at home, because, as I said, the bar of soap does have some bacteria lingering on it. Luckily, soap is water soluble, so just rinsing the bar does reduce the bacteria. So that was my personal opinion, has just been validated.
Oh, that's wonderful.
Yeah, so there's nothing wrong with using soap at home. However, in public places, it's probably easier and more hygienic to use liquid hand wash to minimize the risk of spreading that bacteria.
Okay.
But there is no reason to use either or.
Okay, right. So that's wonderful. So that's been established. For those of you who like it squeaky clean and don't like the slippery feeling of the hands, you can. But as Dr. Samia has said, it's very important that you make sure that you rinse out the bar of soap and you put it back, and to use it at home, because that's very important as well. Using soap in public places. Actually, when you do go, and I can hardly see it now, but when you do see a bar of soap in a public toilet, you don't feel like using it anyway.
No.
Do you?
It looks very grotty. I've been in my kids' school once, in the toilets once, and and I did raise it with them. I said, you really need to install those hand washes, the pumps.
Oh, that's really funny, actually. And I'm sure that they took action promptly about the fact when they saw that he was coming through the door, asking them for that too. I mean, she happens to be the individual that's responsible for the cleaner air in the whole county. So why not? Why wouldn't they be? Absolutely. That's very important. And going on to different the other questions that I have are that, if I choose to have the flu vaccine and pay for it privately, is this something that can be procured by private health providers, such as private GPs, private consultants, etc.?
Shabina, I'm sure it can, because I'm sure private GPs or health providers can provide it. However, if you fall within an eligible group, you can get it for free from the NHS. And it's a good thing if it's on your records and it's been documented and you've received it and it's free. Okay.
Now, I've got another question over here by a Miss Asma from Luton. What evidence is there that pharmaceutical companies aren't making these vaccinations to earn simply a profit? And why do they not advertise and run public campaigns on the dangers of the vaccines as well as the benefits?
Okay, so Shabina, I can only speak with regards to the UK,
of course,
because we live and work here. So in the UK, we've got a scientific body of people. They're called the Joint Committee for Vaccines and Immunisations, the JCVI. Okay. They make all the decisions as to which vaccine is going to enter the schedule, the UK's immunisation schedule.
Yes.
Be it a childhood vaccine or an adult vaccine, depending on which age group you're in. And they undergo huge research on the literature. They look at the evidence base. They look on all the pros, the cons, the side effects that have been documented, and the cost, amongst other things, because we've got a health system which provides care which is free at the point of receipt. So we've got to look at economical costs as well. And the JCVI will only recommend a vaccine to be introduced to the UK schedule if they are happy that the vaccine is safe and it is doing what it says on the tin.
Yes.
And therefore we will not then be introducing vaccines that have that can be dangerous to your health, but quite the contrary, vaccines save lives. I know there is a lobby out there that is not in favor of vaccines, but it is one of the most simplest and proven ways that has had the greatest impact on public health. Vaccination saves lives.
Absolutely. And when we can think about, and this is something that I have to have you hopefully inshallah on another show, but when we think about some of the diseases that have now been eliminated as a result of vaccination, there's no comparison really. And like I say, I always do say, and Sister Asma, if you are listening, I hope that the answer has satisfied your question. But then again, please do be very wary of the fact that it is an extremely dangerous path to tread. And I used to work in A&E, Dr. Samia, and sometimes I would say, we look at diseases like meningitis, for example, and thank goodness there are quite a few strains of vaccinations for meningitis that have come out in the last 10 years or so. And I would say to them that God forbid that this lobby that is against vaccinations would actually be subject to witnessing somebody in a resuscitation area where they haven't had the vaccination, have unfortunately contracted a devastating illness like meningitis, and there is nothing natural in the world that can bring a person back from that apart from medical intervention and resuscitation. Therefore, it's very, very important to understand that when you are going to a naturopath or taking advice from them, the gravity of the consequences that could happen. You could be that statistic if you choose not to have a vaccine. You could be that statistic. Then we can't give a guarantee for anything that you would never contract an illness. But then when you do, there is nothing natural that you can take that can cure it either.
No, most definitely, Shabina. We have seen elderly people, adults, children die from infectious diseases. We call them vaccine preventable diseases, the ones I'm talking about in particular, such as measles, mumps, rubella, whooping cough, meningitis, flu. We have seen people die. We continue to see people die from them. If they survive, sometimes they are left with very serious complications. They may lose their hearing, they may have an infection of their brain, etc., etc. And they are left disabled and crippled in a metaphorical sense. So we see it all the time, and these diseases could have been prevented if those people have been vaccinated. Please talk to your GP if you have any concerns, if you have any doubts. Talk to your GP and they will explain to you about that vaccine. But do not make that decision not to give your child vaccine. I've dealt with an outbreak of measles, and this was the group of parents who some many years ago decided not to vaccinate their children with the measles, mumps and rubella. And we know that in Europe, measles has come back with a vengeance. So it is very important. By vaccinating your child, you're not only protecting your child, you're protecting other people, because one case of measles in an unimmunized child is highly infectious, will very easily get to another child who's also not immunized or has had an incomplete immunization schedule.
Yes, and very pertinent advice as well. And like Dr. Samia has said, we have her as an expert on the show. We are so privileged to have learned people like Dr. Samia who are able to share their expertise. Do remember that an awful lot of years of hard work and training goes into developing these skills to be able to endorse the advice that is given from higher authorities as well. And a lot of hard work and research goes behind that. A lot of sleepless nights into studying for those exams to attain the accreditation as well, to get to the level that Dr. Samia has to be able to give that advice safely. So please take this advice on board. And Dr. Samia, I have another question here from a brother, Akil Sadiq from Luton. Dr. Samia, first of all, very wonderful show. Thank you very much. I am all in favor of giving the flu vaccination. I am not eligible, but I would pay for it to be given to me. Unfortunately, my GP has said no many times, ! I am terrified of the Aussie flu. First of all, we were hit with swine flu. Then we were hit with bird flu. Can you please tell us what the meaning of the Aussie flu is?
Okay, well, I'm really impressed by this member of the public who has asked such an interesting question. Actually, I'm very impressed. Right, so whether it's swine flu, whether it's Aussie flu, whether it's bird flu, flu is caused by 3 types of viruses.
Okay.
It's caused by the flu A virus, by the flu B virus, and the flu C virus.
Okay.
The flu A virus is normally found in wildlife as well, and in birds.
Okay.
But it can transmit to, and it does, and it can transmit to human, and it does transmit to human, and it can not only, it sort of transmits from bird to human, but also from human to human.
Right.
And the B virus is slightly causes a more milder illness, and the C virus even more mild, and it's seen less. So when we talk about swine flu or about Aussie flu, it is a combination usually of the A and B viruses, or the types of A viruses. So when we had the swine flu, it was really the common flu that was circulating at that time and the year after as well.
Okay.
And it was the type of A flu, and it's sort of the A is subtyped. It has further categories in it.
Yes.
The Aussie flu that we are seeing is the H3N2, we call it, which is a type of the A flu.
Okay.
And it is the flu that we had in our last flu season. It is the flu bug that we saw in 2016-17. I'm calling this flu season 2017-18, and I'm calling last year's flu season 2016-17. So it's exactly the same. The reason it's called probably the Aussie flu is because Australia, as I explained earlier, had its flu season before we have ours, because when we were enjoying hot weather, British summer,
they were.
They were in the midst of winter, and so they had
their flu
as well. This strain. But rest assured that the vaccines available, both for children and adult, do protect against the H3N2, which is the Aussie virus. So the Aussie flu. So it does protect against it. So the vaccine protects against it. And with regard to this gentleman wanting the vaccine and not being given it, he most certainly wouldn't fall in an eligible group, which is the only reason why he wouldn't be given it. And we think that by treating the people most at risk, we decrease the chances of flu spreading to normal, healthy people. If you are normal, fit, healthy, without any chronic illnesses, a flu is a self-limiting illness in that it cures of itself. You just need to take your paracetamols and dress warmly, and
plenty of fluids.
Plenty of fluids.
Thank you so much, Dr. Samia. I did not want to interrupt you. We have 40 seconds to the end of the show. I am definitely going to get you back. I'm going to collaborate from now when I can get you back on my show. It was wonderful. Thank you so much. And hopefully, inshallah, we will get you back on the show. And thank you, listeners of Luton and Peterborough, for listening to the show. And to all you children who are listening as well, I want to give a shout out to Awais, Fatma and Jawad. Wonderful children. And Awais, I know especially you are very good because you help your mummy. This is why I had to mention your name especially, and I'm dedicating my show to you 3 children. So next week, join me again for a wonderful show with another wonderful consultant. Many thanks to Dr. Samia. This is Dr. Shabina Sadkayoum for Salaam Radio.
Your number one for local, national and international news across Cambridgeshire and Peterborough on 106.2